Hello, everyone. Welcome. Thank you, Professor in the Sociology Department. And I am so pleased to be introducing you all to our guest speaker, Dr. Janelle Palacios. Dr. Palacios is a practicing nurse midwife, a researcher, a policy advisor, lecturer, and storyteller who grew up just a few hours west of here on the Flathead Indian Reservation. Dr. Palacios has served as the co-president of the Native Research Network, which is the nation's largest organization of health research-focused Native American researchers and allies that was created by Native people. Janelle has engaged in qualitative research working with tribal communities using storywork to understand motherhood formation among young mothers. Dr. Palacios currently collaborates with several researchers here at MSU, myself included, examining rural and racial disparities in access to maternal health services. Janelle has earned national recognition for her expertise in Indigenous maternal health, serving on the Federal Advisory Committee on Infant and Maternal Mortality under the Health Resources and Services Administration. In her role as the co-chair of the Health Equity Work Group on this committee, Janelle is helping to bring national attention to the enduring maternal and infant health disparities that face American Indian and Alaska Native populations. And she's working to help develop clinical and policy strategies to address these disparities. Dr. Palacios served as a content expert on the CDC's Hear Her campaign and is a project design consultant for a nationwide campaign through the National Center for Fatality Review and Prevention, which is working to enhance our understanding of fetal, infant, and maternal mortality review by employing storytelling as a method. She serves as the American Indian Alaska Native Content Population Expert Consultant for the Association of Maternal and Child Health Programs and is working to design an anti-racist health equity research curriculum for them. More recently, Dr. Palacios is integrating storytelling into the Storywork project, which is an innovative health equity tool that integrates history and storytelling to spark action for change for better maternal, child, and infant health outcomes among BIPOC populations. So we are just so pleased to have Dr. Palacios here with us today to share her nationally recognized work on storytelling to help better understand maternal and child health, and to help address health equity and health inequality. So thank you.
So good afternoon. Thank you, Dr. Carson, for the introduction. And I'm wondering where the clicker is.
Did everything okay?
Thank you. So I just tried texting Bozeman, Montana, right, just to test this out. And normally it works, but thank you so much that their service is down right now. And so it's telling people to go to an online webpage. But basically, you can find out anywhere in the globe where Indigenous people historically have been. And so it's a really great tool. And this is a map created by us, Canadian Indigenous person, Victor Temprano, who is really trying to help people understand what the world looked like before colonization started happening, before dispersion was happening. So you can see, when I look at this map, I actually see a few things that really challenged my internalized view of the world. One was that there are really overlapping borders, right? People were in similar spaces. There wasn't a clearly defined border typically of a group, that there were a lot of overlapping areas. And so what this called to my mind is that I grew up on the Flathead Reservation in Salish and Kootenai. And I grew up on the reservation viewing people from south of the border as not my cousins, but people to the north of me, my cousins, my relations. And what I understood later in college is that the border crossed us, right? These are political borders that crossed us as Native people, as people in community. So I like to bring this map and show it that no matter where you are in the world, you can kind of find out where the Indigenous people lived at, where their historical territories were. I have, this is now a question for all of you. whose lands are we standing on right now? Pop quiz, everyone. You know, we're in academia, we love pop quizzes. All right, so we are in Bozeman, Montana. Who are the people that were originally here? Shout it out. Shoshone? Yeah. Who else? What? Salish and Kootenai? Yes. There are more people. Okay. More people. There are more people. Who else were here? Are here. Right, like the Appaloosa. Is that, yeah, like I only know that name. The Crow, right? Yes. Cayuse, Walla Walla, Umatilla, Cheyenne, Sioux. We have people that were Sioux nations in here. So we're basically on lands that Indigenous people have inhabited for millennia. And we now understand that there's new understanding of archaeology that has shown us that Native people have been here for a much longer period of time than we actually thought of, like 20 years ago. So that's it for that little piece of history, okay? You guys kind of did okay. I really challenge you to do a better job next time, okay? So it's really important to understand where you are because land and people have connection. How many people are here because their people have been here for a few generations? Whether you're from families from homesteading, my father's family were homesteaders. Yep. Or whether you're here because of transplants from California also count if you've been here for 2 years, okay? I'll let you count that. It came over here on the big airplane. All right. All right. But land and people have connection. So I'm here to just share with you how strategic storytelling can impact clinical practice, research, and health policy. And I'm going to share with you maternal child health outcomes. This is, sorry, this is three, can you hear me? No. Thank you. Yeah. All right. What you see here are 3 generations of my family members. I'm a nurse midwife. I practice in Oakland, California. And as people were trying to understand what health equity meant and put it in practice, because it was difficult for people to see their own biases, their own lenses that were clouding their vision of someone's experience. So I tried to make it really concrete. And what I did is I took my family as an example. So you see here before you 3 generations of my family, women. You see my grandmother on the far right, Kay. You see my great auntie, her sister, Rhonda. You see my mother in the middle with me. And then I'm on the side and I'm representing other women in my family of my generation. But I want you to know that of these generations here, these 3 generations, my grandmother, auntie's generation, my mother's generation, and then me, these 3 generations, that of the women represented here, these women, these Native women who lived on the Salish and Kootenai Flathead Reservation, experienced more than 12 miscarriages, 2 stillbirths, 4 preterm deliveries, 3 low birth weight babies, 6 hemorrhages, multiple accounts of interpersonal violence, 1 homicide attempt, and a number of suicide attempts as well. So that is just represented in the 3 generations here on this slide right here. When we try to understand what does health equity look like, or try to understand like how do you connect history to outcomes, I created a short presentation which will hopefully help you understand how history is important to understand outcomes and how storytelling can be a method for overcoming these the historical experiences people have had as intervention, as understanding as well. So how many people are familiar with maternal infant health? How many people are in that world? A few people. All right. So for the few people, this is going to be information they already know. But let me just say, Our great nation, the United States, has the worst outcomes among developed nations in terms of how we take care of women and infants. We have women in our country that die the highest rates than developing worlds, okay? So especially among Black and Indigenous women, our women die at a higher rate. Our babies die at a higher rate. So on the far left, you see that for out of every 100,000 live births, there are 13 white women that die, and that's really high, okay? It should not be that high. Among Native women, it's about 30 women, and this is national data. This is not state region data. This is nationwide data, which has its problems. And then if you look at Black women, about 41 out of 100,000 women will die while they're pregnant. So this is really bad. This is really bad. A lot of the developed countries look at our data and they're like, ooh, you don't treat your women well, all right? And if you were to think of the canary in the coal mine, it's the babies. On the, so let me first also share with you that if you look at the top right-hand side, depending on age, if you look at white women in the light blue, they tend to have worse health outcomes when they're pregnant, when they're younger. So when they're 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, their outcomes are a little worse. They have higher rates of hemorrhage, higher rates of infection, higher rates of C-sections than when they're 25 and older. It's exact opposite for Black and Indigenous women. We tend to be healthier when we're younger because when we're older, our bodies have had so much stress on it that it is difficult to carry a healthy pregnancy. And when you look far down at the very bottom, they didn't have enough data for Native women, really, in typical cases. But if you look at education, we expect that if you have a higher rate of education, the more, if you finished high school, you went on to college and you have a graduate level degree, you should have really good birth outcomes, right? Because you're educated, you're healthy, you probably have resources. For white women, that's true. For Black women, they actually have the worst health outcomes. So education and resources are not protective for our Black and Indigenous women. When you look at sudden unexpected infant death or sudden infant death syndrome, SUIDs and SIDS, so infants dying, by far Native babies die at a higher rate than most babies. We swap places depending on where you put your time frame for which time period you're looking at, but we swap places with Black infants. But consistently, Native infants die at a much higher rate. Here is an example of our country, right? Depending on where you put the reference point, 2014 data to 2018 versus 2015 to 2019, Montana was a hotspot of infant deaths, 2014 to 2018. But if you move it by a year, it looks like we're a little bit on the lower end. I want you to see that there is a pattern to infant deaths. And it usually follows where Indian Health Service is, that the hotspots where Indian Health Service services are, those states that have higher Native population have a higher rate of infant death. So we know that Native people have risk factors for preterm birth. There are sociodemographic risk factors like poverty, medical risk factors, disparities in access to care, like being really, in Montana, being really far from a clinic. How many people know where Glasgow is? Okay, and how far do you have to drive to get to a hospital? Like a hospital with like 3 doctors. Kind of far, right? All right, so we know in Montana, like Alaska, services, access to services is difficult. And there's a differential in resources. How many people have been on a reservation, driven through it? A lot of people. How many people have actually driven through a reservation and been to the HUD housing and seen the HUD housing that people are living in, where I grew up in? It's very different. How many people remember the movie Lilo and Stitch? All right, in Lilo and Stitch, and if you're a millennial, you might not have seen it, but in Lilo and Stitch, there's a great scene where in Hawaii, they're showing what actual like Native people, Indigenous people live in Hawaii, and they live in HUD housing like Native people do here. And you see cars out front, you see all sorts of things out front, right? Chassis out on the lawn, you see all sorts of things out front. So
when you go through a reservation, there's the reservation and then there's the reservation. So if you've ever seen HUD housing, been inside a reservation, there's a big difference. All right, why do Native women die? There's not a lot of data. Let me just say this. It's really difficult to even find data on Native women. But when they looked at data on Native women, they said, oh, Native women die from hemorrhaging. They die from problems with their heart. They die from hypertension, like preeclampsia. But what they were not able to find in this was a lit review, they were not able to look at homicide or suicide. And I'm not sure if I have the slide in here, but I will just say meeting with federal partners and Mary Wallace, who is an investigator from the East Coast, she has found that actually when you look at all women in our country and you look at the reasons for deaths while they're pregnant or 42 days after they've delivered their baby, it's not hemorrhaging, it's not heart problems, it's not blood pressure issues that are killing them. Guess what it is? It's homicide, it's violence. You don't have to raise your hand, but I want you to think to your own personal experience of someone you may know who you suspected or knew for sure was experiencing violence while they were pregnant or in the early parts of parenting. It's very common, and it cuts across all groups of people. All right, so earlier in my career, I was trying to help people understand why Native women in particular are at risk for poor outcomes. And in early 2000, there were not a lot of great theories out there. So in PhD programs, they're like, go find it yourself, make it yourself, you can do it. Here are the tools, learn about theory, test it. And so I was like, oh, great, this is gonna be like a roller coaster ride, like white knuckle, let's see what's out there. And at the time, there were not a lot of things, so I had to mishmash a few things. One of the things I had to mishmash was something called life course. And this means that from birth to death, people have varied experiences. People have varied experiences in terms of access to economics, access to money, access to reliable transportation, access to a good road. How many people know what it's like? You have some really big potholes here on Ferguson. But how many people know what it's like in the dead of winter, which is not too far away, that you have an emergency and you need to take a back road or you need to take that paved road, but the road is not good. Like you're worried about having black ice or maybe not having like the best car with the best tires. I have ball tires on my rental. I could not drive yesterday. The people had to come rescue me. But those have real consequences and we don't think of that, all right? So people have differential access to resources. People have differential experiences to racism. And from birth to death, you either have factors that support your life or knock you down or try to knock you down, okay? So that's from birth to life course. Life course was being developed, but what I used was a theory called weathering, and basically it's the same thing. It was something that was identified by a Harvard professor, Arlene Geronimus, and she noticed that Black urban women tend to have different life experiences than white women. And she called her theory weathering. Now, some people take objection because like, I'm not weathered, but really it's all about stress. How many people are engineers or know about allostasis, allostatic load? That's all about the stress on the load of stress on something. So if you think of life, someone's life, the stress load on someone's life affecting their health and opportunities. So, okay. So I was like, okay, I got something here, but this is not necessarily it. Now we have a thing called ACEs, Adverse Childhood Experiences. How many people are aware of ACEs? All right, this is great. Okay, so I'm not gonna spend too much time. So you know, from birth to death, there are experiences that we can experience that impact our health and our behaviors, right? And they have found that these things like neglect, like abuse, like having someone close in your family that you love incarcerated, these have effects on you as a kid. And it can be related to STDs. It can be related to depression, mental health issues, attempts at suicide, cancer, stroke. Does this make sense? right? Great, because you're my favorite people now, because it's going to make it easier when we go forward, all right? And that from birth onward, the more ACEs, the more assaults you have in your early childhood, the more problems you have at risk of developing, right? So I'm like, okay, we have birth to death, but what about like what happened before birth? What about like that mom's life? And then really, what about all of the women's lives before her, right? We're talking about ancestors. So I was then looking, how do I help people understand that? Sorry, this is weathering. This is just a theoretical, you take your photo of this, theoretical constructs of weathering. But how many people are aware of historical trauma theory? Great. So historical trauma theory says there are traumatic events, not just one event, but events that consistently happened onto a community of people, population of people. And as these events happened onto a community of people, it had destructive ramifications intergenerationally. So back in 2003, Microsoft Word had this program. So this paper is my first paper I published where you could only use squares, circles, rectangles, and straight lines. This was my masterpiece. Behold, right? So for everyone who gets has an attempt or is pushed into writing their first manuscript, it's not going to look like this. And there is this little nervous anxiety about sharing it. But this was trying to help people understand that at the first generation since contact, what year did that happen? 1492, right? So since contact, there have been generational effects that have happened on Native people that have large impacts today. So I'm going to talk a little bit about those impacts. We now know, thankfully, that the CDC, Center for Disease Control, recognizes intergenerational trauma, historical trauma, as a construct that has real meaning and real significance on people's health. I love that. Social determinants of health. How many people are aware of SDOH? Right? All right, great. So understanding history helps you understand why we have the current social economic determinants of health today. All right, how many people have seen a photo like this, an image like this that tries to help people understand outcomes related to social determinants of health? Maggie is cheating. I've shared this with her before, but if you look at this tree has no fruit, no leaves, and that's to represent outcomes on Native women and infants, okay? We have the maternal outcomes. We have obesity, diabetes, hypertension, suicide, homicide, mental health, unintentional injuries. We have a lot of things, a lot of problems, a lot of issues. On the left, we see on the infants, high rates of SUIDs and SIDS, preterm deliveries, low birth weight, suicide, sepsis, unintentional injuries. I'm starting to hear stereotypes. How many people can connect like stereotype with some of these outcomes maybe? Maybe a moment later. If you look down at the roots, we have things like homelessness, healthcare access, environmental toxins, poverty, employment, racism. But what's in the soil? What's feeding those roots? How many people want to know what a starlight tour is? Right. What is a starlight tour? Starlight tour is when men of color, usually Native men, are picked up by law enforcement and they are driven far away, usually in the winter, and left. And that person usually dies. It's called a starlight tour. That's something that actually happens both in Canada and the United States. That's an experience that Native people experience and face. And that's not widely talked about or known about. How many people know what blood quantum is? Right? Some people, that's right. Good. That is a federal government policy telling Native people, you have to decide who is a part of the tribe. You have to separate people, your family, and decide who gets things and who doesn't. How many people know when religion was outlawed for Native people? How many people know when religious freedom was found here in this country? Like everyone should know that. That was like a middle school grade thing, right? What year? When did that happen? 1620, right? How about there's an amendment? Which amendment guarantees like the right to freedom? Religious freedom. I heard first, someone whispered first. Yes. But did you know that Native people were banned from practicing their religious beliefs and culture until 1978, a year before I was born? It was banned. It was illegal. You could be arrested and imprisoned. So what's in the soil? A lot of things are in the soil. So we have to amend the soil. All right. So I really want to understand, what are the generational implications that affected health? This is my grandmother, my great-grandmother, and my great-grandfather. Both Salish and Kootenai, both attended boarding schools. I have a whole presentation, 10 minutes long, for those millennials who it's about using memes to talk about Native history. This is one of those slides. How many people know what the doctrine of destiny is? So there's manifest destiny and there's a doctrine of discovery. Sorry, doctrine of discovery. All right, great. Yes. 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 So when Columbus accidentally founded or arrived and was found by indigenous people, the Taino people, and then came back to Rome and reported, and the Pope found out, oh my gosh, there are these lands out there. The Pope instantly created a papal bull, and the papal bull said, if you are a Christian nation and you go out and you find lands that are uninhabited by Christian folk, you can claim those lands, plant your flag, and demand and say that this is Christian land, and you can enslave all the people and take all the resources without any sin. You have the power to bring forth Christianity, and there's no fault to you. You can do this with our blessing. That is the doctrine of destiny. Or I'm sorry, doctrine of discovery, sorry. So it is because of that orientation, that view of the world, that you have a lot of people from European countries that there was no sin connected to the havoc they were creating with Native peoples. So this is a winter count, and I really encourage you to look at winter counts, because as a record-keeping tool, it shows you throughout history when things like measles appeared in communities and decimated populations. All right, in 1491, what was the census for Native people? 100%. There were like Native people everywhere. We don't know, because we didn't keep really great records at the time, but we don't know how many Native people, indigenous people there were in North and Central and South America. There's a debate, 100 million, few hundred million, we don't know, but we do know that in a very short timeline, about 90% estimated of Native people were annihilated, largely by disease. Diseases moved really quickly, very fast, and not just one time, but like a few times, okay? So diseases reached Native people long before Europeans did in many parts of the United States, right? So the victor always gets to decide what the story is, right? Where was this dude when they were writing the history books? Because I read those history books and this dude was not there. We don't talk about this, but our nation's constitution is largely based on the 5 civilized nations that women were largely involved in deciding what happened in government, right? So they don't get that recognition, the 5 civilized nations or the Native women. So we have enshrined in our nation's history, even though we don't know that, but it's enacted every day, of the doctrine of discovery. And then we have a John Gast beautiful portrait. It's beautiful, it's a lovely painting, but this is the Western view of civilization. So this is a Lady Columbia moving from the East Coast where contact had happened and was moving westward. And what do you see in this allegory, this painting, for all my art students out there? What's this showing you as she's moving from the east to the west? What's happening in the east? You see light, you see cities, you see economic, right? You see civilization. And what do you see happening as she's moving westward? What's in the west? See natives, you see like it's thundering, it's like ominous, it's like savage territory, it's wild. You see the farmers are some of the first people coming out, right? And behind the farmers is the economics, like the train system. So this is manifest destiny, yes. History has effects on Native people that it has prohibited Native people from living their fullest potential in health. So the Iroquois Confederacy of 5 nations, the 5 civilized nations, the US Constitution, right? How many people know about the Trail of Tears? Okay, great. So you know that in the late 1800s, that Native people were being forced from the southeast into Oklahoma. Did you know that there was a Supreme Court case that Cherokee Nation won that said they could not be removed, that no one could move them from their territory, and they won it. And that's a landmark case that guarantees tribal sovereignty today. But what happened? No one was able to enforce that ruling, that Supreme Court ruling. No one did. No one went against the president at the time. And so Native people were forced. About 5,000, it's estimated, they didn't keep great records back then, it's not to their advantage too, but about 5,000 men, women, infants, and children died on these marches to Oklahoma Territory. The people who stayed behind, and there were a few people who stayed behind, they hid in plain sight so that they would not have to be moved to Oklahoma Territory. So in the 1860s, as the US government was exploring manifest destiny, was taking all the Western territories and making them into states, the policies changed over time, how the government interacted with people. So most of the treaties were made before 1870. It was like around 1870 was like the last of the treaties were being done. As a side note, the state of California, before it became a state, as a territory, they were told, clean up your Indian problem. And so it was open season on Native Californians. And the government was estimated at the time in the 1880s to have financially sponsored almost $1 million worth of money for scalps that were turned in on women, infants, children, and men. And that's not something that we are taught in our histories. And a lot of nations were wiped out. And to this day, there are very few reservations in California, and the tribes are very small. And they don't have access to Indian Health Service. In Alaska, as a state, when it became a state, Alaska was treated more like a business. So they're called corporations, Alaska Native Villages, Alaska corporations. And so the way that the US government treated them was also slightly different. And then we get to Hawaii. And Native Hawaiians don't have the same access to resources, or it's not enshrined in any sovereignty or any laws about protecting the indigenous people of Hawaii. So the government kind of like wisened up a little bit on how they were going to treat the indigenous people because it was becoming costly for them. All right, this is just to show you that if you look at in the Dakotas, right, if you look at the traditional territories of different Sioux nations in light green, and then in the dark green are the lands that were originally supposed to be held for reservations for Sioux people. And then the orange is actually what the government gave them. So it went from, in the treaties are the dark green. That's all the land Sioux nations were supposed to have. And that happened for pretty much every single reservation. But the government takes these backies and gave them just the orange stuff. How many people know what Black Hills Gold is? All right. How many people have been to Mount Rushmore? Okay, so those are the Black Hills. Black Hills have some gold, they have some resources. When the government found out that there was gold in their hills, they take these backsies, it's ours again. And just so you don't forget it, we're going to carve the faces of some presidents in these sacred mountains of yours, so you don't forget it. So we can see a timeline, the dark representing the indigenous held land from 1492 to today. A little bit different view of that. I want to just point out that the largest land holdings typically are lands that people don't want. How many people have been to the Four Corners area? Right. So at the time when reservations were formed, government was like, oh, no one wants that land. There's nothing there. Well, what's there? Does anyone know what's in the Four Corners area as a resource? Uranium. Yeah. So largely the lands that have the largest landholds are lands that the government and states thought were low resource land, garbage land. Don't need it. You can have it. How many people knew that there were two kinds of buffalo in our world, in the Northern Hemisphere? I had no idea we had two different types of buffalo. There were the woodland buffalo and then the plains bison buffalo we all know today. The woodland buffalo were wiped out. It was a government policy to take away the food supply from Native people, so they couldn't organize, they couldn't be together in large groups. You can see from the timeline that there were over 5 million buffalo in 1870. 10 years later, there are less than 400,000. And then 9 years later, 540. And then just a short time later, 300. All the buffalo we have today are from the remaining 300 buffalo that were not wiped out. Every buffalo dead is an Indian gone. Again, it was to take away a food source, to make Native people starve, to make them dependent on the government, and to take away their ability to organize. And then we had the Dawes Act. So basically, reservations were formed, people were on reservations, and then the land was then divided up, and heads of household were given tracts of land. On my reservation, there was so much land that the head of household, there were far too few of head of household, that the land was opened up. And this is an actual replica of a newspaper advertisement to homesteaders, inviting people to come and buy land, cheap land, Indian land. So my reservation has people who have been homesteading for a while, 7, 8 generations of people. But it is because the government said, even though we gave you this land, we're going to take it back and we're going to sell it. So my reservation right here listed is a patchwork quilt of land held by my tribe and land held by non-Native people. And you'll find that basically all the towns are held by non-Native people. They own that land. It's not tribal land anymore. The purple now is no longer there because my auntie won a case that got all that land back. But the green is tribal held land, and that's largely forested land. All right, you already answered this question, kind of. Let's see, pop quiz again. When was religious freedom found in this country? 1620, First Amendment. Okay, and when were Native people allowed to practice their religion? 1978. All right. All right, I'm going to briefly take us to Wounded Knee. So on Pine Ridge Reservation, a few days after Christmas, some Native people were trying to practice religion. They were organized. The government saw them as organizing, saw them as being violent, potentially being violent, and wanted to disrupt that. So they sent in the 7th Cavalry. It's estimated over 300 people died, largely men, Native men. Just a few cavalry people were lost. This is a mass grave, a pit that was dug. That's frozen land in Pine Ridge Reservation, where people were just thrown into. Oscar Howe is a Sioux Native who years later in the 1960s created this beautiful painting. And President Dwight D. Eisenhower, his family bought this painting. It's now in his library. But this painting is from his grandmother's account of what she experienced as a child. She was a child when this happened, and she was shot in the hand. Who was this? He's Nez Perce, he's Nini Poo. Chief Joseph, yeah. So Chief Joseph, as the U.S. cavalry was trying to round up Native people and get them onto reservations, Chief Joseph was like, not taking that, taking my family and leaving, trying to get to Canada. They were just a few miles from Canada, escaping. And they were caught and imprisoned in New Mexico for a few years. And then Chief Joseph tried to write everyone in the Northwest asking, can we come and live on your land? Can you share your land? And I believe it was only Colville, the Colville people, answered his call and said, you can come share our land with us. And then a short time while later, the Nez Perce people were granted land in Idaho. But their original lands are not in Idaho. It's part of Idaho, but largely Oregon and California. That's where the Ninipu originally were, and that's where the lands that they wanted to be on. A lot of this is about land and resources, taking that away. How many people know about boarding schools? Great. This will be really fast. Carlisle Indian Boarding School, first Indian boarding school, and it was modeled after the military because the military has such a great model of breaking people down and building them up. And that's exactly what they try to do with children. There's a federal Indian boarding school report that Deb Haaland, Interior Secretary, had done that investigated federal-run Indian boarding schools, and they found that it was intentionally done. Boarding schools were intentionally created to break down the Native American family system because it was a strong system. And if you could break that family, you could break the people. So children as young as age 4 were forcibly taken from their communities and put into these prisons for 18, 19 years. And Colonel Henry Pratt, the founder of Carlisle Indian Boarding School, had before and after photos taken because you know what? Propaganda is really important. So this is a before and after of Apache children. This is a very famous one. This is Tom Torlino, a Dene young man, about 3 years after he was taken. This is my great-grandfather, Ernest, who attended Haskell Indian Boarding School. And again, it's a military, like these boarding schools were very militarized. The young men were shaped into becoming in a very militaristic role. He's wearing this uniform. They were taught skills and trades. And when they went back to their communities, they were often, survivors of that time talk about not having the skills equipped for their community to partake in their community. They didn't have the language anymore. And they carried with them abuses, physical abuse, psychological abuse, verbal abuse, mental abuse, right? Sexual abuse. Not just one time, multiple times, not just by adults, but by children as well. In the Federal Indian Boarding School report, they found that boarding schools encouraged older children to punish younger children. And intentionally, children from the same tribe were torn apart, taken apart. Brothers and sisters were put in different boarding schools. They did not want children to have an identity. And because of this experience, we have what's called the Pan-Indian, the Pan-American Indian experience, a shared common history. Some more propaganda. Look at that front row. Like when I see those babies in the very front and know that they were held captive for years, it just is astounding. And it helps me understand and contextualize why we have mental health issues in our communities. When you take away religion, when you take away cultural practices and you outlaw them, there's no way. Well, it makes it very difficult to get through that trauma. And so what do people do? You can't practice your own religion. If you can't access a way that's going to help you through that trauma, what might someone do to get rid of it, to not think of it, to escape it? Yeah. Drugs, alcohol, exactly. They might enact the same harms onto other people, right? We know from the Carlisle Indian Boarding School that there were a number of children that died. This is a graveyard of 186 children that are buried with head markers. We know that a lot of Native children died on outings, like field trips. Well, what we also know too, that there are accounts that lots of children tried to run away and lots of children were murdered. We don't know how many. In Canada and the United States, Canada has a more, they've embraced more of a truth and reconciliation policy where machines go through historical boarding school grounds and find bones, right? They find mass unmarked graves. Happened in Canada, happened here too. And children's bodies and infants' bodies were found in these mass unmarked graves, oftentimes run by the church, but sponsored by the the Indian Boarding School. This is in downtown Albuquerque. When Albuquerque was undergoing, they were doing a public works project in a public park, they came across all these bones. And then they realized, oh my gosh, this is where the Indian boarding school was. They found all these bones, these children's bones in Albuquerque, downtown in a park, unmarked grave. September 30th is the National Day of Remembrance. We are still finding bones. We don't know how many people have died or passed. And now we have people coming forward sharing their own accounts of witnessing traumas, witnessing murders that they have suppressed. All right, so as the boarding schools fell out of favor, residential ones far away fell out of favor, then residential ones on reservations were created. As those fell out of favor because of a lot of abuses were happening, even on my home reservation, we had a boarding school on the reservation run by the Ursuline nuns. In 2011, about 40 adults stepped forward, sharing their history, their stories of trauma and abuse at the hands of nuns and Jesuit priests. And they sued the Ursuline nuns. So these traumas are not that far away. Like they didn't happen like a long time ago. This is still in living memory. As the boarding school era kind of fell out, Native children were then hustled into foster care. Today, Native children are disproportionately in foster care more than any other group of children. So even though Native people are a small population, there are many more Native people represented children in foster care than any other group. In the 1950s, the federal policy was to say, you know what, let's get rid of the reservation. It's not working. You guys need economic independence. Why don't you get out there and join the workforce? Hey, we'll get you a one-way ticket for you and your family, and you can go to LA, you can go to Chicago, you can go to New York, you can go to San Francisco, you can go to Minneapolis. So some people did do this because they were promised that they would have jobs, they would have a house, they would have a community, they would have a better life. And that didn't pan out. That didn't actually work. It was a way to terminate tribes, and some tribes were terminated, like lost all recognition, no longer a tribe, not recognized. And people left and drove. And that's how we have that's how we have now the urban Indian population, Native people who could not find their way back to their communities. So Luana Ross, she is Salish and Kootenai as well. She did her work looking at the construction of deviants of incarcerated Native American women. She shared that the federal government has embraced conflicting policies regarding Native people, shifting from genocide to exclusion and confinement, and later to supposed assimilation. The rhetoric was integration, the reality was confinement and domination. So the US policy was like, let's first just kill everyone, and then if that's not working out, let's just kind of move to the side. We'll just push them westward. We'll just take this land and that's theirs. And then it was like, but that's really good land and we need more resources. Let's just make sure they have smaller areas. Let's make sure that we make sure their children, the next generation, are assimilated. So we'll do assimilation and acculturation. We'll make sure that they become like us. And then when that didn't work out, they're like, okay, well, let's see. Let's just give them a little bit of power. So that is, in a nutshell, how the US policies have affected Native people. All right, I shared with you a little bit about how, oh, my clicker. All right, I'm an M&M fan. So this is a common issue. How many people, so I asked people, how many people know what blood quantum is, right? So in the United States, it's not widely known, this is a secret, but that American Indian Alaska Native people is actually a political designation. It's not a race, it's not an ethnicity, but we use it as a race or ethnicity. But legally, American Indian Alaska Native people, it's a political designation because they are sovereign. They have sovereignty, they have different rights, they have different relationship to the US government. But the US said, you have to decide who's a member of your tribe. And so they really pressured Native communities to decide who was going to be Indian. And oftentimes they encouraged them to take a stance of 1/4 of that particular Native American tribe. So you could have multiple different Native American identities in you, but if you did not make 1/4 of any one tribe, you're not a tribal member. Other tribes have decided different criteria, but that is just it in a nutshell. If you have American Indian, Alaska Native identity, or you are enrolled in a tribe, you have access to some resources like HUD housing, like commodity foods, like Indian Health Service. All right, this is the highlights of being a tribal member. All right. You also had a one-way ticket as a Native woman to be sterilized. And in the 1970s, between 1973 and 1976, over 3,000 Native American women were sterilized when they only reviewed 4 of the 12 Indian Health Service sites in a 3-year period. And they decided not to look any further, not to look at any other years, not to look at the rest of the 9 Indian Health Services, when they found that over 3,000 women had been sterilized in a 3-year period, and the youngest was 11. But that doesn't happen just in history, still happens today. And it happens disproportionately among women of color, women of culture. This just happened. This is happening along. How many people are aware of this? You're in the news, you're paying attention, right? All the border issues and ICE. So Latino women, Hispanic women were kept at the border and sterilized against their will. Missing, murdered Indigenous women and girls and people. That's something that a lot of people are not very familiar with as well, but that impacts our community. Incarceration. So by far, Native American people are overrepresented in incarceration. And I would just say that this data it's old, but it hasn't changed much. So here's the state of Montana. If you look at the proportion of population, like if you have over 80% of Montana identify as white, but they only make up 69% of the people who are incarcerated. But look at Native people. They make up 6% of this population, but over 22% of people who are incarcerated, like 3 times. Death from police brutality. Native people die 3 times the rate of white people. Native people die 2.5 times the rate of Black people. And that's actually here in this graph. The high spike is green. It's the Native American death by police brutality. So what do we know about Native American health, right? We know that there are a lot of risk factors for it. More recently, working with Montana State University's Torsen Power couple at the very front row here, we know that Native American women drive significantly farther than white women to access care. And they're 20 times more likely to give birth at a hospital without OB services, even though they have more complex obstetrical pictures. And it's really more pronounced among reservation dwelling women. I'm going to skip through this, but that was just to show you that homicide kills more women than hemorrhage, infection, and hypertension. Okay, we are an asterisk nation for the most part. Our numbers are so small, we're the asterisk, we're the something else. And so we have to consistently tell the state and hold the federal government accountable that you have to count us. You have to know our outcomes, because if you don't know our outcomes, you don't know how bad it is, or how good it is, or how good it could be. So where do we go from here? I'm going to share with you a very brief story. This is just to demonstrate how story is really important. Newly married at age 24 and pregnant for the first time, working for social services within my rural community. My husband, also young, worked long hours. We had a rocky start to our relationship, filled with violence and alcoholism. But when I became pregnant, we grew as a couple and the violence ended, though his drinking continued. I was dutiful in my pregnancy, scheduling all the prenatal appointments I was told I needed, and rarely canceling them, only when the roads were too icy and dangerous. When I was about 6 months pregnant, the clinic nurse told me I had protein in my urine. She notified the doctor, who said I was fine, not to worry and to go home. That weekend, I became terribly sick. I had the worst migraine in my life. I was nauseous and bleeding. Something was wrong, and I felt awful. It was winter, and the roads were icy, but I went to the local hospital. I was transferred by ambulance to a larger hospital 65 miles away, bleeding and feeling worse, with no details from the medical personnel of what was happening to me and why I felt horrible. When we arrived at the hospital, I found out my daughter had died, and I was told they needed to induce me. Shortly after starting the induction, I delivered my stillborn baby girl. I stayed a few days in the hospital, no family or friends at my side. During my recovery, no one educated me on the illness I had just experienced. No one at the hospital asked me how I was doing mentally nor emotionally after having just lost my baby. I was told to take medication to prevent seizures, but no one educated me on how to care for myself postpartum or after the loss of a baby, nor how long I should wait before trying again. Wanting to move on, we became pregnant quickly, and because I was considered high risk, my clinic appointments were in the larger town. To attend one 15-minute appointment, I had to drive 120 miles round trip. At the time, we had just one car we shared. Again, I was pregnant during the winter. The roads were bad, and I had to cancel appointments simply because it was too dangerous to drive. One day at work, while 6 months pregnant, something felt off. I did not realize my water had broken. I thought I was having light discharge, but then started spotting. I called the doctor's office and was told to come in. When I arrived at the hospital, I was in preterm labor and bore my son at midnight at our local small hospital. The doctor told me my son would not live throughout the night. I was not allowed to hold my son. They whisked him away to lay in an isolette alone within the nursery. But you see, my son Kelly is a survivor. He lived despite the doctor's prognosis and was immediately transported 500 miles away to a neonatal center. I could only touch my son, not hold him, just touch him. A week later, while visiting him, Kelly was born weighing 1 pound 12 ounces, and he lost weight his first week of life, weighing 1 pound 6 ounces. Because he was extremely preterm, a lot of the care he received was experimental, and I signed a great deal of paperwork that I did not completely understand, relinquishing the hospital from reliability. A hospital social worker told me that my son would likely die, and she encouraged me not to change my routine at home, to continue working and live my life. My son had many near misses that I witnessed when I was present on the short spans of time I could visit, but I was not able to be with my son the entire time he stayed in the hospital far from home. When he was about 3 months of age, he was transferred closer to home to a new neonatal center that had just opened, with staff who were new to their positions, and a number of mistakes were made in my son's care. I was taught CPR in case I needed to resuscitate my baby, and when he was discharged around 5 months of age, I had to use CPR a few times when he stopped breathing. When I returned to my clinic doctor without any understanding as to why I had a stillborn baby during preeclampsia with my first baby, I went into preterm labor with my second. I remember the doctor encouraging me to continue trying for children. He said,
So why story? When we look at data
there are different levels of data. On a community level, that was Rhonda, 23 years old, Salish, Kootenai, 3 prior losses, 2 live births, 29 weeks, or about 7 months. Preterm labor with known risk factors like violence, smoking in the household. Delivered a preterm son named Kelly, weighing 2 pounds, or actually less than 1 pound. In stable housing with a stable career and access to one reliable car, access to Indian Health Service. That's like community level data, like program level data. When we look at county level data, we see less of the story. This is what it looks like. When we see state level data, we see that her identity as an American Indian woman is sometimes dropped out altogether and labeled as other. We see federal data, it's usually other or an asterisk. The work of story work magic, the importance of story and storytelling is that we are born with story. We're humans, we connect with story. The shortest distance between 2 people is a story usually. We think in story, we learn in story. It is a part of our connectedness as humans. Story can improve memory. It can provide instruction. It can help people identify problems, and it can provide motivation. There is a story math, and this is that. If you can change the head and the heart and affect the heart, then you can change the hands for the action. So if you can change how someone thinks and believes, and you can change how their heart feels or empathizes, you can then change their actions. So story changes us. Have you ever felt that feeling of getting the shivers when you're talking to someone, when you're connecting to someone, or you're listening to music or watching something? That's storytelling. That is connectedness. There's a science behind storytelling. When they hook up 2 people to MRIs and they look at the brains of the person telling the story and they look at the brain of the person who's listening to the story, they light up and the wavelengths become the same when there's connection found, when there's identity and empathizing found. So if you really can change someone's perception of something, if you can change someone's view of a stereotype, and you can change how they empathize or think about something, it changes the way they think, it changes the way they act in the world. We need history and we need story. They synergistically work well together because without history, we don't understand that context. Context is really important to understanding why something is happening the way it is now. The story I shared with you, does that sound like something that happened, that could happen today? In any of the communities that happen today? Right, I see nods, yeah. It happened 44 years ago on my reservation. My auntie, she's talking about her birth experience with her 2 children 44 years ago. And that hasn't changed. It hasn't changed for Native women, hasn't changed for rural women, but it certainly hasn't changed for Native women because that still happens today. So how can story be used in the policy level area? You can use story as intervention for helping people change the way they think and believe. You can use story as a way to gather that data because when we take away the story and we strip it to the variables, we lose all that context. It doesn't mean much. But if you use story in policy making, which is something that I did recently in September on a national advisory committee where we invited people with lived experience to come share their stories of what it was like being Native, being a woman, being on reservations, being in urban settings and accessing healthcare. You can see that people were moved. The big wigs with the federal suits were like, how can we help? What can we do? Their stories were so powerful that it really changed how federal policies are trying to change, but they need more people to buy into that. It takes more than just a few stories. It takes people as a community, in community, to make sure these changes happen. I am a staunch Montanan. I will live in Washington State, I will live in California, but I will always be Montanan. And I always introduce myself as a Montanan first, and then I live in California. And that pride is that I have community in Montana. I no longer have anger for all the injustices that have happened to our people, but I have a shared belief that we can be in community with each other. So the more people who buy in or have this similar view that we are one nation, that we are in community with each other, that we can be better all together and still have differences. But it takes all of us respecting one another, seeing each other as humans, then we have a better future. And oh my gosh, we are the laughingstock as a nation to many nations because we don't have a community. We say we do, but we don't. So how can we move that? Find connection with people. You're all bobcats, right? There's a connection, right? You all have rivalries with like the Grizz or the Huskies, right? Bring that to the table and share that connectedness. And then slowly introduce new ideas to people. Because we need all of us to make these changes, not just for Native women, but for all women in our country. Thank you very much. I just have one question or one thought. So you have sticky notes. I'm going to skip the memes because I feel like we have a lot of rapport already, okay? But sometimes the fastest way of building rapport is to build some laughter into it. But I feel like I got some laughs. I mean, that guy over there is a little hard to get, but I think most of you will be nice. All right. So I want you to think for a moment and think about, what does it say? Think of a ridiculous family moment or an embarrassing moment. And 6 words or less, write it down on your sticky note. So a headline might be, what's an embarrassing moment for me? That's about 6 words. So mine might be something like, deadly SBD in an elevator blaming someone else, right? Like it's something so embarrassing, but that makes you go like, what? I want to know more, right? I want to know what was going on in that elevator. Who was in that place? Maybe another one might be, oh, sitting in P. Diddy's seat. Okay, that actually happened to me. Sitting in P. Diddy's seat. Who wants to know more about that story? Right? All right. Okay. What's another one? I'll think of another one. But you too, it's your assignment as well. Because I'd like you to, if you're brave enough to share your 6-word story. All right. So while you're thinking of that one, I'm going to give you one more. Think of a moment that led you to seek higher education. What is a 6-word headline? What's a moment you can think of that led you to where you are today? But the intention of this exercise is really just to give you a taste of these headlines you create to generate someone wanting to know more about that story. Sitting next to P. Diddy or sitting in P. Diddy's seat, I was hoping that no one was going to catch that red eye and I was going to sit in that bulkhead 6F seat and it was going to be mine the entire row. And the last person to arrive was P. Diddy and his handler. And P. Diddy was like, excuse me, you're in my seat. And I was like, oh, I'm so sorry, let me move, right? Like thinking, oh my gosh, I don't get this 3 seats to this in the row. And I didn't recognize it was P. D because the handler, though, kept making a big deal, calling, hey, Sean, you need me to get your bag, Sean, hey, Sean. And I'm like, what is up with this guy? It's like 6 in the morning. He's causing a lot of ruckus. Like everyone's just trying to go back to sleep. And then I looked at the guy next to me and he's wearing sunglasses on his airplane, 6 in the morning in Seattle. And then I was, oh my gosh, he's smaller than I thought he'd be in real life. All right, does anyone have a story, a 6-word story that they want to share from higher ed or from a ridiculous, embarrassing moment? Yeah, please do.
Family moment. It was mother ruins son with word and joy.
I see a tantrum or something happening. I really want to know what happened. What did Enjoy do? Right?
Sex educator.
Yeah. Oh, now I'm really intrigued. Now I'm like, did you embarrass him? Like, okay, this is great. Anyone else want to follow that up? It's hard to beat. But it makes you want to go find out what was going on in that story, right? So open invitation, going once, going twice. I'm going to invite you to stick your sticky up on the wall that, let's see, just over here as you're leaving up on the wall. No one will know that you wrote it, but it'd be wonderful if you feel like sharing it. I'm not going to remember who had a pink pen, who had a red pen, who had what sticky, but the fact that you're doing this shows that you're trusting and is also like a short informal way of measurement of how many people are right. Okay. I am here to answer any questions and we can also move to the next space too.
Thank you so much for this presentation. I'm Sally Moyes. I'm in the College of Nursing, and I have heard of nursing students who are learning about research. And this week we were talking about qualitative research. So I'm wondering if you could a little bit about your methods of taking the story into the science.
Yeah. So you have to know the question that you want. You have to know what are you really trying to understand, because that's going to frame then the method of qualitative inquiry you're going to use. Because in qualitative research, there are different beliefs or ways of looking at data. So if you want to know a process, that's more like grounded theory. If you want to know lived experience, that can be narrative inquiry or that can be phenomenology. If you want to know, let's see, so a lot of oftentimes it's like the experience of an illness or the experience of something is very popular in nursing. If you want to know how do people make decisions, that's grounded theory. That's more grounded theory. The big thing to know is that quantoids try to take qualitative data and try to like make it quantitative, because qualitative research history is that it wasn't real well respected. So quantitative people were like, we're going to make this respectable. We're going to make numbers assigned to language. And so it was a very rocky entry. But I just want to also say that a lot of Native communities, Indigenous peoples around the world use story as a way of collecting data, as a way of sharing information. So how do you take it? How do you take qualitative data into the science? Just like how I showed you when we look at data, if you strip away a person's experience by age, race or ethnicity, and outcome of their pregnancy, it takes away a lot of that contextualization. You really needed to know she lived in a rural area. There are bad roads in the winter, and that's not well communicated in the data that was presented. So there is a space for data, that for qualitative data or story in every place in science. And stronger sciences tend to have both methods together and integrated. Except those bench science people, you know, that are in the petri dish and messing around. So they have no understanding typically of like qualitative work. Any other questions?
For analysis, with like solo or with community participants,
This is a really great question. That would be like a response to a dissertation committee, like how you describe that. But there are different ways of looking at it. Either, you know, is it that you're a scientist and you grab other scientists and you guys read the transcripts and you all agree that this is the way it is, this is truth? Or do you invite the people who actually shared their story and you get them to also be involved and you ask them, does this mean something? Does this resonate with you and your experience? So there's a variation of what that analysis looks like. And I tend to be of the variation where you invite the people who participated, you invite the community into the analysis. Mm-hmm.
So comment, if you can repeat the question.
Oh, sorry. Yes. Yep.
Yeah.
Any other questions? Or are you all ready for food?
Yes. So when you are reporting on stories like this, how do you scale your findings? Like, how do you get it out, the message book, the community who you work with, and then to policymakers? What are the strategies that you use to take something like a video and make it into formats where people are going to still connect that story?
Mm-hmm. So the question was how to disseminate your research findings, right? How do you make it? You have to market it, basically. We've been researchers, really successful researchers are really good at marketing too, okay? Because they have to showcase their work. So the more that you can have publicity on the work that was done and have like a news station or have an article written about it, the more that you're able to share the results of the research in the community, in the wider community, and then nationally, like at conferences, the more people will be like, oh, that's really interesting, and you make connections. So I would say people are using Instagram, they're using like other social media to get out their findings, they're using PR campaigns or contacting news places. They're sometimes writing their own article for like the local, like where we were, Bozeman, like I don't know what the Bozeman periodical is, the newspaper. Okay, I was gonna say the Chronicle or Gazette, but you know, sometimes you can write it for a writer there because they're inundated with lots of stuff. But when you're at conferences is another vehicle. Really successful partnerships, like especially when you're doing work with communities, is to invite community members or have it built into your design so that they're also participating in disseminating that research and disseminating that work, because it's their work, it's their stories, it's what's affecting their lives. You are the person that had skills and expertise, but if you're able to share that light with them, share those resources, it leads to a lasting impact too. And the government loves those kinds of relationships, and they love any PR you get. So if you do get an article in the Chronicle, then you send the copy to your funder and like, look at this is amazing, and it gets them jazzed up, and they're more likely to fund you.
Here we go. There are two hands up online. Okay, so we see some hands up online. I'm not sure.
Repeat the question.
Oh,
Can't
yes.
hear the audience. I'm sorry.
Okay. So I'm not sure who have their hands up of the participants, but this makes it difficult to answer questions. But if you send an email, we'll try to answer it later. But I think we should probably transition to reception parts of things if nobody else has a question, but unless we have one right here. Okay.
So I personally do not do work with Four Corners or like the Navajo Nation. I have colleagues who do, who are from the community. So I have not done work, but Navajo Nation has a very robust internal review board and IRB board, and they're very active and involved in all the research that goes on. And they typically only allow research that is going to be in partnership with their community, which is a really strong model. bringing resources to their community for the health of their community members. Do you have did that kind of answer your question? Because I have very limited experience with Navajo Nation.
Yeah, I was just wondering, that's my reservation, so. I didn't see Navajo listed on
So I'm not sure, like the maps I used, I pulled off because if it had the red spots on it, that was where the uranium mines are. And so I apologize if it didn't show Navajo Nation on it, but that was a map I pulled from off the internet. Any other questions?
I'm sure we can chat afterwards, but thank you so much again. Time to mix and chat and have some snacks. So thank you everyone for coming. Please put your stickies on the wall.